All right. Well, good morning, everyone. Welcome to our prevention perk for July 2021. I've been excited about this topic just because of the nature of what we've all gone through in the past year. And I get out more often than I was for a while, meeting with coalition members and community members all across Southwest Missouri, and have heard any number of stories about, the challenges, and in some cases, some of the technological advances people have experienced during the pandemic, and how they've been able to utilize that as a strength. So it just kind of depends on, where you're at and what your community's perspective on everything we've gone through has been. So I tried to come up with a good representative of coalitions to chat with us today, both from the metro area around Springfield, and then reaching out further into more rural settings, if you will, just to kind of get an idea of how things have really impacted us. Scott Allen is joining us from the Webster County Community Partnership. Alan Krieger is the leader for the Ozarks Fighting Back. Julie Veely is part of the Springfield Green County Vape Coalition. Marietta Hagan, I think you wear hats at both Stone County and in Taney County. And Philip Whiteman is our most rural individual. He's way out in Newton County. I'm hoping that he gets the signal out there. I told him to put some aluminum foil on his antenna and he'd be able to hear us here in the city. So, and I just kind of thought it'd be good to hear from people from all across Southwest Missouri about, what we've been going through, and kind of what that's done to maybe shape your coalition today, and how you're maybe utilizing some newfound strengths or opportunities to redirect. I don't really know. I'm curious to see what you've come up with. And we can all use this, hopefully, as it's always been designed with the prevention perk, as a takeaway for things that we can use at our coalition levels, whatever those happen to be, or wherever that happens to take you. Before I forget, I wanted to let you know that we are doing this for those that are used to the perk on a regular basis. We've gone from twice monthly to once monthly. We're going to do the third Thursdays of the month. So we'll look forward to August 19th as the next prevention perk. And I believe our guest is going to be Tyree Davis, who works here at Community Partnership. And we're going to have a conversation about diversity, equity, and inclusion, or as I told him in our language, we're going to talk about cultural competency. So I'm looking forward to that as well. Tyree is a very dynamic individual, and he leads our DEI initiative through the partnership. And I think that he's been eye-opening for me in regards to things that I can utilize at any of the coalitions that I help to support. And hopefully there's some things that you can learn from that conversation to take back to your community. So you'll get a reminder of that, save the date, and a reminder for August the 19th will be our next prevention perk. So let's go ahead and just fire this thing up and get started. I sent each one of the panelists, if you will, a list of questions that I wanted to try to work through. It, nothing too complicated, just a basic conversation about the status of how things are. And in no particular order, I do know that Scott's never been shy, so we'll start with him. And the first question I was going to ask from each one of the panelists is we'll just ask the question, give each one of you a chance to kind of answer it, and then we'll move on. And then we'll save some time at the end for anyone to ask additional questions if you would like. So how did the COVID-19 experience impact the work of your coalition? And kind of let us know, like, where were you at on like March 11th? I don't remember if that was the exact date, but where were you at that time? And then what happened when we went into, lockdown, so to speak?
Well, and I have to preface this by saying that Webster County Community, and Unity is capitalized, partnership is more of a unique coalition than what a lot of you are used to, because we don't have a focus solely on substance misuse prevention. So that's a big part of what we do. We're certainly a substance misuse prevention coalition, but we really focus on all of the health and social service type issues as they relate to our small county. So I think the biggest thing that it did to us was it took the focus off of the work that we were doing as a coalition, and really moved to that. Everybody had to shift their own individual worlds to their own COVID response. So it really just took that amount of time that someone would have had to put towards their work with the coalition away from coalition work. And one of the first things that we saw was, and I worked with this coalition as a prevention specialist at CPO, and then came to work for the health department here in Webster County. When I first came to work here, we planned an observance of World Mental Health Day, and really we're building some momentum behind that, and then had to pull the plug on that because of COVID-19. So I think the big thing, so just we lost a lot of the time from folks that people had to be able to devote. We had to shift the way that our activities, well, we had to cancel activities. And then the other thing was that shifting meetings to that virtual status was a big move for all of us.
Thanks, Scott.
You know, and I am kind of shy.
How about in Stone and Taney County, Marietta? What was the impact that you guys realized early on from COVID?
I think the biggest impact that we noticed was the lack of people that existed after COVID-19 hit. And it made us realize that the composition of our coalitions maybe needed to be a little bit broader. Although we had somebody from all the sectors because of the DFC grant, we noticed that the most engaged of us were those that were working for the public health department, for the mental health providers, for the healthcare providers. And of course, those are the teams that got pulled away when COVID hit. And so our roster was pretty bare for several months, and some people still haven't returned just because they've been so committed to their COVID duties. So it has really made us look at reaching out more into the community to maybe get some more grandparents and parents and business sector and other sectors involved that maybe we didn't have represented before, and that weren't as critically impacted as much as those others were. Those were probably the biggest. The big difference, so I represent Taney County ADAPT, which is a DFC funded coalition. We're in our 8th year. And then I also, and we have a primary focus on substance use and youth substance use prevention. And then I also represent Stone County Community Health Coalition, which is a little bit more like what Scott mentioned. It is a community coalition that focuses on 3 main topics, mental health and substance use being 2 of those. And we have applied for DFC funding. So it was interesting to see the difference between the 2 coalitions and how COVID impacted them the same and differently. In Stone County, it gave us an opportunity to apply for the DFC funds because we really had nothing else going on. We weren't doing events, so we really dedicated that time to creating that application. Where with the Taney County Coalition, we had reporting and we had things that we had to accomplish because of the DFC funding. So we had to really focus on finding new ways to do that in order to meet our requirements for the DFC funding. So it was kind of interesting to see the difference between the way the 2 coalitions functioned during the time.
Well, that's exciting about the DFC application. So
yeah, keep your fingers crossed for us. We are supposed to find out in August. So.
Good. Julie, what about with the Springfield vape and tobacco?
Yes, very similar to what Scott and Marietta said in regards to let me back up. One major thing that we had was change in leadership within our coalition. Kara Irwin was the chair But due to COVID and changes in roles and responsibilities, she had to step down. And I was part of her team within the Springfield Greene County Health Department. And so I just kind of took over a few of those roles, and then officially became co-chair along with Brad Brumble with Springfield Public Schools. So that was one big change with the coalition that kind of happened in the fall of last year. And then we also had 2 grants. So we really had to kind of figure out how we were going to move forward with these grants. With the mini grant with the Department of Mental Health, we were focusing on education and increasing availability of vape products through the drop boxes. And so with the education piece, we had a lot of in-person activities that we were planning on doing with the schools, like the open houses and the orientations, to be able to provide informal education to parents and students. And so we kind of had to shift that, and we really shifted to more of an online presence through social media. We also did some paid advertisements, and then we also created a website to be able to share the SAVE curriculum and provide some education and resources on cessations for parents and students. And then also with like the coalition, we saw kind of some ebb and flow in regards to participation. And so one of our goals right now is just to work on kind of assessing and re-engaging members and reaching out to some sectors that are not part of the coalition.
You guys have done some really good work through the pandemic, and I just love the online resources that are available now for all communities to kind of tap into if they'd like that. If you're not aware of it, Julie can talk more about that maybe as we move forward. Alan, I know there's been changes with OFB in a lot of different ways over the past year, but what do you think the impact was as far as COVID and how that affected Ozarks Fighting Back?
Yeah, it's much like the other panelists have mentioned. Kind of just as the community had to kind of slow down and schools kind of closed, it really impacted our ability to get our prevention efforts out into the community. It's hard to target kiddos in the school when they're not in school. So that was definitely an impact. And then our coalition is such that we have a lot of different subcommittees that are doing a lot of the work and trying to keep those smaller groups kind of going and together was pretty difficult. As folks were trying to figure out their own COVID response and trying to set their own, safety thresholds and deal with, issues within their employment. So it was difficult for that. And we had leadership changes, within OFB during that time. So, I mean, we've kind of taken a look at that and kind of saw the same thing that Marietta mentioned. We kind of need to diversify a little bit our span in the community, try to widen kind of our involvement within the coalition to try to just make it broader and easier for us to bring folks in to kind of do the work of our coalition. And so we've kind of tried to maximize or make best use, if you can, of this time with kind of restructuring some of our prevention efforts and kind of taking a look at our operating guidelines and kind of figuring out how we can kind of change direction a little bit and try to kind of just refocus with everything that's happened in our community.
Yeah. And you guys had a lot of big changes. I don't know how much everyone on this call is aware of what OFB has gone through, but some leadership changes, but also the infusion with the Greene County Partnership for Success. So it's an exciting time for I think for pretty much all the coalitions that are represented here, in light of everything that we've had to go through together. So I'm excited to see that. And then Philip, talk to us a little bit about down in Neosho in the Newton County area.
Well, I have to echo a lot of what most everyone was saying, but I came into it almost midship. I came in late June. So I've only been in this about a year, and so I came in the middle of shutdown. So I was learning this new job and as a DFC coordinator, and it was especially challenging for someone like me because I didn't know what the heck I was doing and figuring that out, and then trying to get creative on top of that, which I think has also helped at the same time in the long run. So we didn't have a huge social media presence, barely any at all, really. Zoom wasn't really a thing with us. We had been shut down for a couple of meetings already prior to my arrival. So getting the technology side of things learned, and I was new to Zoom. I don't want to exclude myself there. Learning that, getting that down, Wi-Fi issues, being in a rural community where we meet doesn't have a very strong signal. And again, the technology, I had to buy some of my own equipment, that kind of stuff, and had to make all that function. And then Facebook and Instagram, mostly Facebook, and it's amazing how powerful Facebook still is. So we relied heavily upon those two avenues, doing virtual meetings, Facebook events, and I believe it was Scott or someone said, schools are shut down, and that prevented an obvious challenge because with the DFC grant, we really need leverage resources as in-kind matches with the grant. So that, I think, would be the biggest struggle side. Marietta could probably echo that one, is trying to find those matches, because there was no easing on that from the federal government. I was told in one of the conferences I attended virtually, one of the coalition meetings, that there is legislation before Congress, but it does take a legislative act for that to be forgiven or eased. We are in year 9, about to enter year 10. We got approved for year 10. So I don't think that will be a thing while we're still around with the DFC. So things started letting up, about halfway through my first year. Immediately started getting back into schools, trying to connect with the administration, the teachers, the kids. We've been doing events. Red Ribbon Week was kind of a video challenge virtually. We had responses. We held a prize for those that did the challenge. We did a picture challenge during Social Awareness Month, where they held up a sign that said, I chose to do this instead of alcohol or drug, something. They were given free license with that. So we've tried to do things like that, where it's kind of limited exposure to people, make them feel comfortable and keep us safe at the same time. And I think it's working. It's a slow progress, but it's a progress.
Well, that's kind of the next thing I wanted to explore a little bit is this, for instance, Prevention Perk. We weren't doing this prior to COVID, and this was a topic that was discussed during the NPN conference. And I thought that it was someone had done a presentation on some of the things that they were doing as COVID had us all sheltering in place or at home or whatever that looked like. And I thought, well, let's start one through the partnership. So this is a brand new advancement because of COVID. So from the coalition's perspective, and Philip kind of alluded to that, doing some things with some of the social media platforms that may have existed before, but they had to really become adopters of that. What are some of the things that maybe you as coalition leaders had to take on board, or you thought, wow, let's try this or let's start that was maybe utilizing technology or other avenues? I don't know what you might have got creative with. So I see Marietta kind of, yeah. So was there some things in Stone or Taney County that really kind of just presented themselves as a great alternative?
Yeah, probably our biggest one was related to drug takebacks. We of course didn't do the spring of 2019 drug take back because of the pandemic. And we really had a lot of feedback from the community, especially our local police partners, that event really decreased the amount of drugs that they were seeing being deposited in the permanent drug drop boxes in their lobbies. And so they asked us, hey, in October, we would really like to do this, find some way to do it. And so what it ended up us looking at was expanding the way that we do the drug takebacks instead of hosting as many live take back sites. We really focused on partnering with more pharmacies. So where in the past we'd only partnered with the pharmacies that we were actually hosting the live events at, we now partnered with almost every single pharmacy in the 2 counties to have them give out the information. So we prepared info bags for them that had a medication destruction packet and a business card that talked about our permanent drug drop boxes. And so for a 2-day event over the weekend of when that DEA national one was, the pharmacies themselves were handing out those bags and medication lock boxes and educating people about medication safety and disposal. So it really forced us to switch that. And now we've decided that it worked pretty well. And going forward, we're going to continue that component as well as expanding our live sites whenever we're able to, but continuing to work with all of the pharmacies, not just the ones that that we are hosting the live sites at. So that was a really good expansion and how we kind of had to think outside of the box just because the community wanted it, really.
That's really great to hear that the community kind of was asking or, wondering, what are we going to do now that we got to go to plan B and don't have a plan B. So
right.
Great adaptation. Julie, anything from your coalition's perspective that was new and innovative?
The SAVE website, as I mentioned earlier, I think it was after one of the prevention perks that Amanda Droll and I presented at. We presented on the local coalition and the SAVE program, and we had some interest in sharing our curriculum and other resources, and we created a website and thought it would be the easiest way to utilize that as a tool to be able to share what has been developed. And so we have a website, it has different tabs, and schools can basically go on and fill out a Google form. We have 2 different options. One is if the school or the district or the teacher or community member, whoever is interested in it, if they want to do the data piece of it. So we have a pre and post test survey, or if they just want the resources, they complete the other form. And then we just follow up with them and share out the resources that we have created. So that has been something new and just another great education and awareness resource for us.
Thanks, Julie. Scott, anything new development wise for Webster County?
I'm humbled to be in the presence of such overachievers. No, interestingly enough, and as I'm listening to this, really what wound up happening with us was that, and maybe it was just because of COVID, but we actually never really focused much on outreach as much as we did on how can we maintain the coalition and maintain that support for each other. So it became more of an internal support than an external community support, if that makes sense. And there was an awful lot of how can we, as health, social service, and essentially community wellness providers, how can we support each other to get through this pandemic, as opposed to what can we do for the community? So kudos to those of you that were still able to do that outreach, because it certainly is important.
Yeah. Alan, anything you could add to?
Yeah, it was, I agree a lot with what Scott was saying. It was very similar for OFB. We kind of went into, Zoom was a brand new world for our group, and, requiring Zoom for all of our different subcommittees and things like that. It was challenging. And, as lucky as we are to have Zoom during times like this pandemic and things, it's just not the same as sitting down with a group of folks and having a conversation about, your goals and where you're trying to go. So it is just different. But we kind of did the same thing that Scott was talking about. We really had to kind of focus on, how do we keep all of our subcommittees operational? How do we keep folks engaged? How can we keep folks coming to the OFB meetings and, keep and not lose momentum, with the goals that we were trying to reach. And so we kind of looked internally as kind of how we ended up kind of looking at it and decided, it was a good time for us to review practices and come up with new structures and new ideas to try to make our coalition grow and try to get ourselves in the best possible footing that we could for as the pandemic winds down to really kind of get back at it, if you will, and try to be more impactful than we were prior to the pandemic.
Right. Yeah, thanks, Alan. Philip, anything more you can add about changes in how you interfaced?
Well, I've pretty much already mentioned those, but Scott mentioned something interesting there that got me thinking about, for some reason, I didn't really think about this until he mentioned that, but yeah, that's what we did. It was just almost unintentionally. We regrouped internally, as you mentioned, and we developed a new board. When I came on, we had a couple new members already, new sector members, and we kind of took the time to really choose ones that were actually engaged already in the community and try to play to their strengths as much as we could. And I do think that helped us out. And I think we currently have a great board, current sector, good coalition group. With the technology side of things, I think the biggest struggle is getting people to read emails. Before it was difficult. I think an increased piece people are kind of getting tired of that technology now. Forget who it was. I think it was Alan that mentioned you can't beat face-to-face meetings, and I agree with that. Again, fairly new, just a year old with this coalition, but I remember as a member prior to being part of this that there was a lot more done because you could verbally, you could just sit there and you can interact with the speaker, with whoever's presenting, or answer questions. You could pass stuff around, sign up sheets, that kind of thing. Sending a sign up sheet digitally is so much different than in person, as I think every single one of you could probably empathize with.
Yeah. It presented challenges for everyone, and so the next question that I want to kind of explore is kind of the reason that we all are here, is the prevention aspect and what the impact, not necessarily on the prevention side of it, but the impact on changes in use patterns. So I knew I sent this question out, and then last night I was listening to the radio, and there was a news report about the overdose deaths in the United States since COVID, and it's just astounding, up like 30% over the previous year, and it's the highest that's ever been recorded. So to me, that probably indicates that overdoses have gone up. That probably indicates that abuse has gone up, et cetera, et cetera, et cetera. I can't imagine that overdoses are isolated. We don't have that collective data, and we'll start to get some of that in the fall of 22 or the spring of 22 as the kids start doing the next round of Missouri student surveys. But until then, it's kind of like anecdotal maybe, or maybe you've had conversations with law enforcement or healthcare providers or that kind of stuff. But really, in your communities, how has the pandemic changed those youth use patterns, or the implications for mental health, and not just hypothetical? Have you heard that? How did you hear that? And the reason I'm asking that is maybe one of you's come across an avenue that's helped to illustrate that, and we can take away that to our communities and find out maybe what that impact has been where we live. So anybody have a pulse on how patterns have changed or the impact on mental health?
I think the impact, Steve, has been pretty intense. I mean, we don't have, like you said, I don't think we have data yet to be able to truly reflect that, or to prove that, if you will. But the kids not being in school results in, a lot of those kids have lost their support networks. A lot of those kids are relying on their teachers and their counselors and folks to be able to kind of help them out and kind of keep things going well for them. And that access isn't there, during the pandemic. And I think, just even with my own kids, we've had to be a lot more intentional to try to guard their mental health during this time, because they're not with their friends every day at school. They're being, stuck at home. They're losing interactions with the community, and you have to be really intentional, I think, to try to keep that mental health in focus. And I just think it's been something that as a community, it's been hard to do that. I think, I think depression is probably going to be something that's went way up for a lot of folks during the pandemic, because I mean, people are not designed to just be secluded, for a year, and we know that along with, depression, mental health, substance abuse rises. And so I think, it's going to be, I think, pretty dramatic, the data that we see when we start getting that pulled in.
What about from the perspective, I know you're kind of, talking off the cuff there, and we're talking about coalitions, but I know in your professional role day to day, have you seen this an impact with through the juvenile office?
Yeah, I mean, I think we have, families have, really struggled, I think, to try to keep access to resources. I know our office is focused really hard on trying to get resources into the hands of our families to try to deal with all the different issues that come up. Even community resources that families have been relying on, some of them have closed, or some of them had to cease operations. So then it was a matter of, folks trying to find new resources in the community when everything is shut down is really difficult. Yeah. And I think just, even access to like counseling services and things, some counselors, had to change the way they were doing things, or, trying to go online. Not all of our families have internet at home, or not all of our families have the technology to be able to switch over to Zoom and continue counseling, or to, access their online education, and so it's just, I think it's had a pretty big impact, I think, in our kids, in our community.
Julie, how about, I know that aside from the coalition, you do work at the Springfield Greene County Health Department. I mean, what is their perspective on, the health, not just physical health, but the mental health or substance use? And is there anything that you have all learned through that arena?
Mental health has been a priority within the health department, community-wide and internally, and we just continue to have conversation after conversation. And lately, we've been focusing a lot on internally the mental health of our employees, just trying to do what we can to boost morale, give our employees time off, and just try to avoid that burnout. A lot of us have transitioned to COVID response and have been in that for a year and a half. Some of us have been able to transition out back to somewhat normal responsibilities, but we still have several that are still doing vaccines and investigations and outreach. And so just trying to come up with a plan of how to keep our staff healthy, and especially in that mental health piece. And so that we've just had a lot of talk about mental health and it to be a priority, and especially at the community level.
I know, just from observing it from the outside, your organization has kind of been on since day one. It's like
since day one. I remember the first case we got.
Yeah. So
down in the conference room, got word that we had our first case. Yeah. Yes.
So in Webster County, with I know you kind of alluded to that, Scott, being through the health unit there, but any conversations with other local officials about, substance use going up, or concerns about suicide or mental health in Webster County?
Interestingly enough, Samantha has called me a woo. So I'm a connected kind of a person. And one of the areas that I found that we weren't really well connected in was with our elected officials outside the county. So last week, we invited in our 2 state representatives from the northern and southern part of the county to visit with us. I wanted to talk to them about our COVID response, and I wanted to talk to them about the great work that our staff is doing, and give them a tour of the facility. We were doing testing at that time. We never even made it out of our conference room, and the entire conversation was based on the rising concerns and issues with substance misuse. So while certainly I knew that it hadn't gone away, it wasn't our primary focus. But both of those state representatives wanted to focus on, we've got people that are addicted to substances, that are dying from their substance misuse, and what's the health department going to do about that, and how can we all work together? And we spent over an hour talking about that, and then that led to some conversations with local law enforcement that indeed we do have a worsening problem. And I think you have to take an integrated approach. A lot of folks, everybody wants to focus on, I shouldn't say everybody, a lot of folks want to focus on treatment. And then in law enforcement, we want to arrest people. And what we're skipping though is, and I equate that to building a very expensive barn door to keep the horse out once it's out. What we really need to do is build a barn door and keep the horse in and focus more on prevention, which I think is where we're headed now as a coalition.
So Philip, I know that not only do you wear the hat as the DFC coordinator, but you're also still licensed to carry a badge and a gun, I believe. So you have a history with law enforcement. What kind of things do you hear in Newton County from your connections and your unique history in the community?
Well, okay. When all this started, I was still, of course, in law enforcement full time. And I was involved heavily with the schools as an SRO. We had a monthly mental health committee that met, and of course that spawned subcommittees and events and whatnot. And it was the school district was doing a very good job at trying to focus on youth and mental health and prevention, of course. That kind of came to a grounding halt. And although without asking them directly to be able to pinpoint and correlate this exactly with the pandemic, timing wise, we saw an increase in youth related crime. Anything from stealing a rabbit from the state fair to breaking into cars, that kind of stuff. And we saw an increase in uncommon drugs to Newton County, like acid and heroin, that kind of stuff. Skittles parties, I wouldn't necessarily call uncommon, but it's not every single day. But we saw an increase in that. We had a couple kids pass away from that, from having those types of parties. We had, like I said, we had kids tripping out on acid. I mean, a lot of it as well, several times. The crime increase in fentanyl has really surged in Neosho specifically, but Newton County as well. We've had, just off the top of my head without looking at the actual numbers, we had probably 4 overdoses in the last 3 to 4 weeks. And for such a small town, that's a lot. That gets noticed. And of course, you're having to make those notifications to parents and schools and whatnot. And like I said, I can't directly tie that without asking those questions specifically to those victims or suspects. But I think we've seen an increase in just about everything with youth, with adults. Boredom, of course, is a factor in that. People in this pocket, and you guys think even in Springfield are still considered Southwest Missouri, of course, you have a real hesitancy to wear masks. You've got the mentality of, I don't want the shot, I don't want to wear the mask, you can't tell me what to do, etc. So you see a little bit of rebellion associated with that.
Yeah, I think that's a common denominator in a lot of places, but yeah. So Marietta, how about in Stone and Taney County? Any read on substance use going up or mental health issues spiking?
Yeah, definitely. And most of it, like you said, is anecdotal. As a part of my full-time role with the hospital, I get to interact a lot with treatment facilities, recovery support providers, law enforcement, and public safety through other avenues. And just hearing them talking about what they're seeing in our counties definitely has seen an increase. I guess one of the benefits that we've seen come out of it is more interest and willingness to engage in harm reduction. So when we started to see a lot of those overdoses going up, we started getting more opportunity to get Narcan into the hands of some of the recovery support providers, the treatment providers, and even our sheriff's department signed up to be a Narcan Leave Behind program. So it overall had a bad impact because we were seeing more overdoses and more mental health issues. But in the long term, we've got them doing something that they probably wouldn't have considered doing before. And they're also now handing out Narcan from the jail as people are leaving, because what they were seeing is people were getting discharged from the jail, walking down the street and overdosing on the corner. And so it was something that really opened their eyes. From our treatment provider side, the increase in requests for youth services has exploded. I'm thinking of one specific youth provider here in Taney and Stone County. They ended up opening a second office in Stone County because they've really just expanded so much of their youth and family services during this time, where a lot of other businesses are, facing shortages of customers and shutting down their doors. They're expanding because that need is so great in our area right now.
One of the things that I've heard, and it's with one of the coalitions, Amanda Foster's on the call here, but it's one of the coalitions that she helps to support down in the Ozark County area, is the rise in, and I'll just generalize it, a lot of extra time on their hands, and kids using substances, and then of course getting school repercussions, out of school suspension or whatever the case may be, and just really grappling with, it's not that it's new, there's just more of it in the last year and a half, and what can we do to get some more targeted education at some of these youth that are really at a higher risk, because in probably 9 cases out of 10, it's not just that the kids having an issue with substances, their family is known to have some significant issues with substances. So all of that's kind of, rose during the pandemic. As we move towards the wrapping this up, I'm kind of curious from each of you, just kind of how you feel your coalition's doing. If you took its pulse, is it struggling? Do you feel like you've really not been impacted? Do you feel like you're performing, better than expected? I mean, you're from all across the spectrum there. How do you guys feel that your coalition's doing? And with that in mind, where are you at right now? Like, what is your focus? I would have liked to have said that now that we're moving back to more normalcy, but for some of us, we're being asked to consider wearing our masks more often, and that we're on. I know Scott's been on the national news talking about COVID from the perspective of the spike here in Southwest Missouri. So, but given the fact that we're going to remain hopeful that things continue to improve, where do you see your coalition being now and springboarding, let's say, into a year from now? Like, what is going to be your primary focuses, and if they're connected to COVID, or if you've kind of found a whole new direction, what is it that you feel like you're going to be doing next? So, Philip, you want to talk about that for a bit?
Yeah. Oh gosh. I'd say, considering all things considering, I wouldn't say we're stellar, but we are a little better than expected. We're back slightly above the numbers we were just prior to COVID. We're back to hybrid meetings. So we do the Zoom and we do in-person combination. And like I said, we've got a pretty stellar board and group of volunteers. So it's getting those things going again. We just did the Newton County Fair, as I mentioned earlier. And we had 6, which I know isn't an epic number of volunteers, but it's a start. And I think if we can continue with this momentum, we will continue to see that pulse increase. I think it's going to be a good thing. I think we've got to get a year ahead of us, provided we don't get shut down again. But even if we do get shut down, we've got some safeguards in place, like the digital options. We don't want to do that, of course, but it's there. So hopefully we don't come to a grinding halt this time around. We can ease in some areas, but continue to try to be creative to find those avenues. Right now, like I said, we're allowed back in schools. So we're going to focus pretty hot and heavy with that, because that's obviously where our youth are at. for Newton County. We have a few different schools in this district, and it's trying to get them all involved. Awareness is always a thing that we work on with the coalition. Even that last event, the fair, it was quite a change from just a year ago of how many people never heard of us to, oh yeah, I've heard of you guys. Can you remind me what you do? That's a change. That's positive change. At least they know the name. And even if you have to explain to them. To answer your question, I see a fairly bright future for us, even though we're entering our final year of the grants. I also think that's going to be a good thing as well, because it's, the focus has been through all this of being self-sustaining. And, we don't need all of that grant necessarily to accomplish things. A lot of things we do are donated. The booth space, when we do the drug takebacks, that's, aside from advertising for that, that's pretty much volunteer. That's free space. There's a lot of things you can do with less money. So I don't think that part's going to be a factor for us, a negative factor.
You might want to mention, I know that you're having the Talk Op Says Stop presentation, and you said there were still some openings. If you have a link where if people are interested, if they could register, if you want to put that in the chat, people might want to be interested in seeing that presentation. It's really, I think it's pretty impactful and a lot of takeaways.
Sorry about that. Absolutely. I've been to, I think 3, maybe 4 of his presentations over the years. And as Marietta and us were discussing earlier, you're going to see a couple repeated things possibly, but as a whole, he keeps it fresh and as up to date as you can. No one's going to be able to keep up with what the latest drug trends are up to that day. But there are sometimes where he has something brand new as of the morning of the presentation to share. So it's very wonderful. I don't see a single person spacing out in any of his talks. So he does a fantastic job. He's one of those entertaining speakers. It is July 29th. I'm doing this on the phone, so you'll have to give me a minute after I shut up here to find that link, and I'll post it. But yeah, we have about 40 seats left, and it's most certainly worth your time. Chick-fil-A will be provided for lunch, and of course, it's all free of charge.
Thanks, Philip.
Yep.
So, Alan, how do you feel OFV's doing right now, and what are your plans today moving forward?
Yeah, I think we were definitely impacted pretty good by the pandemic. I mean, we definitely felt, that, but I think we're improving. I think things are getting better. I think as the community generally begins to approach something of a new normal, it's allowing us to kind of normalize again as well. We were hoping maybe to go back to in-person meetings pretty soon. With all the community spread right now, that may have to be delayed. But I think, we've come out of it pretty well. I think, we've got, like Philip said, we got a lot of really great people on our subcommittees and on our panel, and they're really dedicated to the work they're doing. And so I think as we're able to get everybody back together and kind of use the new structure and new organization that we've got in place, I really think the next year will look pretty good for OFB and our ability to engage the community. So I'm pretty hopeful for it.
Yeah, thanks, Alan. So I think it's good things are coming out of your work there and partnership with the PFS. Julie, how about for Springfield Tobacco and Vape? What's your pulse on where they're at now, and what are your plans for the future?
I definitely think we're improving. There's always room for improvement, right? But we're exploring some new partnerships and also exploring kind of a new population to work with, along with focusing on strengthening our coalition. So we're excited. We received the mini grant again this year. So we're focusing on expanding the SAVE curriculum and continuing our community awareness campaign. But we just started a conversation with Missouri Eliminate Tobacco Use, and in discussing ways to work with our local universities and colleges to address policy, education, awareness, and cessation.
Yeah. A lot of work still to be done in that area. You would think that the message had gotten out by now, but it's not good for us. And I thought I'd draw everyone's attention to the fact you put the link in the chat for the website information that you referenced. So if you're interested in learning more about that, it's in the
Yes.
chat, and it looks like Philip put in a registration link for the Tall Cop, so it's in there as well too. So Marietta, how about down in Stone and Taney County?
So for Taney County Adapt, I would say in the beginning, definitely struggling. We were going through some major leadership changes. We lost our project director right at the beginning of the pandemic. And so we had some real challenges last year. But we have a great project director in place now who is looking towards building our sustainability as we're in our end of our eighth year for the DFC grant. And so I would say we are improving in Taney County. We've got some great activities that we've been able to do. Like I mentioned, the medication safety event. So there's definitely some areas that we're still struggling. Engagement is one of those. We had just started returning to in-person meetings 2 months ago, and now we're back to virtual. So I think there's always going to be those struggles for the next couple of years. And it's something like Philip said, that instead of it putting a hard freeze on us and us just shutting down for a couple of months, we were just easily able to transition back, which was nice. For Stone County, I think performing better than expected. Our membership has grown substantially, almost doubled, I guess, in the last year. And like I said, we had the opportunity to apply for those funds. If we get those funds, that means great things on the horizon for Stone County. We're also looking at possibly applying for the mega grant that is being offered by DMH right now. No, don't shake your head. There's 2 in the area, so we all have a good chance. But it's been a great time to really focus on growing that coalition. And so I think on that one, I would go better than expected.
Yeah. Thank you, Marietta. It's exciting for Stone County. There's a lot of, that's probably unprecedented to double your numbers, unless you only had one person at the table pre-COVID, but to double your numbers is really unheard of. Most have either held the line or as some of us have reported, we've seen a loss in membership attendance. So
yeah, I feel definitely very blessed because in Taney County we did lose several, but it's just been, I don't know what it was in Stone County. The people just kind of rallied around the coalition over there. So.
Great. And Scott, how about you finally? What's the pulse for Webster County's community partnership, and where you go?
I think the coalition is going to come out of this stronger, and we've got some cool things going on. And we've been fortunate that the stars have aligned in our favor. So to that end, we early on, so through the health department, we have a program called Maternal Child Health. And the focus for our maternal child health grant for the next 5 years is going to be on building protective factors in Webster County, and kind of how that interrelates with youth development and youth growing up healthy, wealthy, and wise. So then once we decided that of course brought in the coalition, and we actually worked with the coalition to help decide that was going to be our focus. That ties in very nicely with CPO's Partnership for Success grant, which then brought us together talking about how we can work together with the coalition, with CPO, and make all those things come together. And then now, once we get the mega grant that Marietta is not going to get,
now,
our coalition, and there's a lot of intermingling between the health department and the coalition. I chair the coalition, but and I also chair the health department. But the so the commitment is that through that mega grant that we will hire somebody full-time. So essentially it'll be like a 2-year DFC, if you will, and we're really hoping to build some momentum there. The other thing coming out of this, there's a group that started locally called Sleep in Heavenly Peace. And they're all about building beds for kids that don't have a bed to sleep in. So they may be sleeping, doing the couch surfing thing or whatever, but that really has kind of brought to the forelight or front light for us that we have an issue with homelessness in Webster County. So we've been working with CPO and we're really gaining some traction on addressing that. We've now appointed a task force to look at that. So I think that everybody's ready to, COVID's not going anywhere, but we're ready to deal with things other than COVID. And I think those are going to be our two big issues for the next couple of years. We'll be really getting back into what does substance misuse prevention look like for Webster County, and how can we make some generational changes, and then kind of the same thing with that generational changes as far as addressing homelessness.
Thanks, Scott. Thanks to everyone. Well, this has been, for me, been very informative and encouraging that, we're still doing great work despite what we've all been impacted by. And it sounds like there's a good future for everyone on the call today. Health-wise with your coalition, sounds like you're ready to do great things when COVID is a distant memory. Don't know when that's going to be, but we can remain hopeful. Are there any last minute thoughts from that any of you would like to share from the panel? Anything that you want to add is that maybe I didn't ask as informally as a question?
I'd like to hear a little bit from the new prevention coordinator for CPO about the direction of the organization and how that ties in for all of us regionally in the service area. Thank you, Katie.
Are you referring to me, Scott?
Am I?
I don't know. I don't have anything specific to share on that just yet, but for those of you that don't know, I am the new Prevention Resource Center Director at Community Partnerships. So, you've been seeing my face. I've been working here for the past 4 years or so, but I'll be a little bit more involved on the substance use prevention side of things. So I'm excited to, continue to work with you all. But I don't have any specific large vision just yet, but stick around.
Anything else from our audience? Anyone else have a question they'd like to pose to our panelists in the last minute or two?
I should mention, by the way, Louise Bigley is with us today, and Louise is one of our nurses at the health department and has really, since coming on board just a few months ago, taken on a huge leadership role in that maternal child health grant that we talked about, or contract, and also in what will be the mega grant that we get that Marietta doesn't. So for those of you that haven't met Louise yet, plan on getting connected. Quite probably Marietta will be picking your brain, I'm sure, as we move forward. And then that way we can both have a mega grant. Nothing but love, Marietta. Nothing but love.
Thanks, Scott. I want to thank all the panelists for being on the perk here this morning. Like I said, I've got a lot from this. I hope everyone in the audience did as well. We do record these, and they are placed on the CP Ozarks channel on the YouTube. If you have coworkers, friends, family, coalition members that you think might be interested in hearing from this, give me a day or two to make sure that it's all posted up there. But that's where you can find it going forward. And mark your calendars for the 19th of August for our next prevention perk. And if the stars are aligned, we'll have Tyree Davis talking about cultural competency. That is, I think, a great subject for all of us in our communities that are doing prevention work. So thanks, everyone, and we'll see you soon.